So we're going to move on to Cynthia Hallett, who is going to talk to us about e-cigarettes, vaping, and smoke-free indoor air policies in public and private spaces, trends, challenges, and opportunities. And I think it's a great transition from what we just heard about with what these products are. And I really appreciate that because I, like most people, have heard, luckily, I have a high schooler, but I've only heard about them in the news. So it was great to learn that, and now to hear about the policies. Hi, Cynthia. Ms. Hallett is an experienced public health professional with a demonstrated history of working in public policy industry, skilled in prevention, policy development, and analysis of organizational development, health policy, and public speaking. And she has 30 years of experience in tobacco and cancer control prevention, and nobody wants to hear from me. So, Cynthia, if you could.
Wonderful. Well, thank you very much. And I agree. It's lovely to follow Brian King's overview of what the products are, and then to be able to share with you kind of how we're dealing with this in the public policy advocacy movement. Americans for Nonsmokers' Rights and the ANR Foundation have been working for the last, in total, 4 decades on clearing the air of secondhand smoke so that everyone can breathe clean indoor air. So it's a real pleasure to be here with all of you talking about indoor air quality and how we can sustain the smoke-free accomplishments that we've gained thus far and how we can expand them going forward. And not every place is smoke-free yet, even dealing with combustible tobacco smoke. And now we've got these emerging products of electronic cigarettes and actually marijuana. So going to cover a couple of things today, and then hopefully we'll have some time to have some Q&A. I thought it would be good to at least start with kind of the beginning, and where we were initially. We really value the input from our research partners because, we work on our advocacy based on knowledge, and we like to have the science behind us, but sometimes our advocacy efforts are a little ahead of the science, and we provide an opportunity for the research community to then evaluate the policies that we've been working on and hopefully give us more information and kind of that foundation for strengthening some of the policies that we're working on. And that's certainly been clear, I think, with respect to moving from where we started in the 1970s at the inception of the non-smokers' rights movement, where all we really wanted was either a smoke-free or no-smoking desk or a non-smoking section, because we didn't have any science until 1986, when then Surgeon General C. Everett Koop came out with his report that said the simple separation of smokers from non-smokers was insufficient to protect that non-smoker from the hazards of what was in secondhand tobacco smoke. And with that, we changed our model policy and our philosophy to start working on stronger smoke-free laws versus just sections. However, in the 1990s, we didn't have a lot of science that told us that ventilated smoking rooms also were not protective of those in the no-smoking spaces. Our research partners demonstrated that there was leakage and seepage of that secondhand tobacco smoke into the otherwise, no-smoking spaces. But in the 90s, we advocated for policies where we could have those separately enclosed, separated, ventilated rooms, until we had the science to support calling for absolutely 100% no smoking in any type of workplace, whether it's a small business or a warehouse, a restaurant, or a bar. 100% smoke-free indoor air in all of these workplaces at all times. As we moved into, 2010, we really started expanding workplaces. It used to be that there was just gambling and casinos in Nevada and New Jersey and then maybe along the Mississippi River. But really now 48 states have some sort of commercial or tribal gaming, and those are very large workplaces in some communities, particularly if you get out into the regional or rural areas in some states. And so therefore, we've been working very diligently to also make casinos as workplaces smoke-free, and then certainly colleges. And in 2010 is about the time that we started inserting other tobacco products into our model policy. As Brian had noted, e-cigarettes had hit the U.S. market somewhere around 2007. We started getting calls about these products showing up in otherwise smoke-free environments, and the patrons would say, "Don't worry, it's just vapor mist." And as Brian noted, it's not just simply water molecules. It is that secondhand aerosol is a combination of nicotine and volatile organic compounds and fine particulate matter. And so we, again, really advocated for making sure that if we wanted truly healthy, smoke-free indoor air environments, then it had to be devoid of all of these different products. And as I note, these shifts towards these stronger provisions were really supported by a combination of public demand. When we had sections, they said, the smoke's drifting, this makes no sense, and then the science, which really helped us. And I want to give a shout-out to also our partners at the Environmental Protection Agency, certainly that January 1993 report, which classified ETS, or secondhand smoke, as a Group A human carcinogen, certainly gave us the foundation to stand on to have additional evidence for why we were advocating for these types of policies. We've never been anti-smoker. We're pro-clean air. And so, we've always talked about maybe finding ways to smoke responsibly outdoors. If you are an adult and make the decision to smoke, that is your choice, but you can't smoke in ways that harm others. So currently, where are we with these smoke-free workplace protections? This map is a result. We have a national database whereby we collect and analyze local and state tobacco-related laws, not just smoke-free, but this map represents the localities and the states that have a 100% smoke-free workplace, restaurant, and bar law, either at the local level or at the state level. And for some of the states, we wanted to indicate that, some of them may not be smoke-free states, but for instance, Louisiana does have a smoke-free workplace and restaurant law. And so there are some states that have incrementally moved forward, but given where we are with the science and policy trends today, our goal is to take what is now 61% of the U.S. population being protected by these strong smoke-free indoor workplace laws to 100%, of course. And this map, we like to note, we do work with our tribal partners and sovereign nations, establish their own policies. They are not governed by local and state laws. So this map does not represent the tribal laws that exist. There are some, but they are not reflected on this map. So given that we have 61% of the population protected, that map looks pretty good. So there's a perception out there that, the job is done. We're so close. And for a lot of people, they say, well, where I live, work, and play is smoke-free. So, what do you mean people are still exposed? So we're working hard to change that perception that the job is done. And to illustrate that the reality is we still have significant gaps in certain places and states, that we do have these emerging products, whether they are the electronic smoking devices, and we have persistent opposition from the industry, tobacco industry and its allied partners. While the tobacco industry may be well on a path to kind of walk away from the combustible cigarette now that there's the electronic cigarette, it's just shifted kind of its advertising and some of its political interference strategies from the combustible tobacco policies to now these electronic smoking devices. And again, I'm going to talk a little bit about marijuana because there is some overlap both with electronic smoking devices and certainly the creation of secondhand smoke. Just briefly, I'll mention that in August of this year, we released a report, the Bridging the Gap Status of Smoke-Free Air in the United States, again, to highlight some of the successes that we have made thus far, but really to identify some of the challenges and closing some of the gaps. The report itself features 12 states, and throughout all of the states, we talk about how the use of electronic smoking devices has become a new interference tactic and or a stumbling block in some places. Some of the early adopters of smoke-free laws did it well before we had electronic smoking devices, and some states are concerned, or localities, about going back and trying to add electronic smoking devices to their laws because it does give any opposition an opportunity to come in and to try to undermine or weaken smoke-free laws. You would think with all the science that we have and the low smoking prevalence rate with respect to, adult and youth use of combustible tobacco, that this wouldn't be such a problem. But if there's any opportunity to roll back laws or to preempt local activity, the industry is still a very strong opponent to our work. Okay, so we are sort of playing a smoke-free whack-a-mole and trying to address electronic cigarettes and marijuana. Both do create a form of indoor air pollution. They both create PM 2.5, so that fine particulate matter, which is very easy to inhale and have it lodge deeply into your lungs. And so therefore we believe that neither of these products, again, should be used in indoor environments if we want to achieve healthy, acceptable indoor air quality. So one of our partners, Dr. Phil Gardner, came up with this language or framing of the triangulum of looking at tobacco, e-cigarettes, and marijuana because it really is now becoming this sort of package deal as we're looking at individual use of the product as well as what the public health implications are of both use and exposure to the product. So you can see that with electronic smoking devices, one of the reasons I want to also talk about marijuana is that you've heard from Brian in terms of the lung injuries that you can vape many different substances in these electronic devices, in particular those mods as well as the pods. When you can adjust and make your own e-liquids and mixing them however you want or putting in your own products, you can see even from this slide that while Juul may not be officially making weed pods, those are available online, and you can then put that into your Juul. And so whether you're a high schooler or an adult at your school or in an airport or in a restaurant that is not yet smoke-free and or does not prohibit the use of e-cigarettes, one doesn't know what an individual is vaping. So we have been looking at one of the ways to reduce, use is to also include e-cigarettes and marijuana in smoke-free laws because that will also reduce exposure. But there is evidence that including e-cigarettes in smoke-free laws, A, reduces use of the product, and B, can also be a youth initiation prevention strategy. And we'll get to that a little bit later. So currently there are about 900 municipalities and 21 states or commonwealths and territories that include electronic smoking devices as a product that may not be used in smoke-free environments or smoke-free venues. Again, this is data that we get from our laws database, and I think it's helpful to see a lot of places don't feel that they can include e-cigarettes. In fact, the most recent campaign when we were working in Atlanta, Georgia, because Georgia had adopted a week smoke-free law, so it's not 100% across workplaces, restaurants, and bars, but they adopted that before e-cigarettes were introduced to the U.S. market. So when the city attorney in Atlanta was trying to evaluate whether or not the city could regulate e-cigarette, the initial decision was that, well, we don't think so because it's not covered by state law. And so it took a lot of education to let the city attorney and the city council know that e-cigarettes were introduced in 2007, 2008, that other communities had done this. Here's a list and a map of all the different jurisdictions and states that do include e-cigarettes and smoke-free laws, and then also to provide some of the evidence, again, about what's in secondhand e-cigarette aerosol and what are the benefits of including it in their policies. So there is a trend toward including these devices in their smoke-free policies. So we know from the 2012 Surgeon General's report about preventing tobacco use among youth and young adults that smoke-free laws do indeed contribute to setting that social norm of tobacco-free living. It does help, these smoke-free laws do help adults smoke less, think about quitting, and it is seen as a youth prevention, youth initiation prevention strategy. So what we've also been seeing here is that obviously the benefits of including e-cigarettes and smoke-free laws is that it prevents exposure to the particulate matter, toxins, and volatile organic compounds. It reduces social cues to smoke or vape. So for folks who are trying to quit smoking or who have quit smoking but now maybe see somebody vape, it's not a trigger for them to think about engaging in that habit again. Again, it increases social norms for tobacco-free living. And it may prevent initiation of vaping and increases the perception of risk. There was a study that was published in the Journal of Tobacco Control in May of this year, the associations between public e-cigarette use and tobacco-related social norms among youth. And it was interesting to see. I think this is one of maybe a few studies that have looked at this, and we look forward to more. As I said, we love when the research and science gives us more information so that we can strengthen the advocacy work that we're working on. But again, including, basically the summary of this was that including e-cigarettes in the smoke-free law had a greater effect on, again, youth perception about the hazards of e-cigarette use and preventing initiation. Much more information in the study, but in the interest of time, I will just cut to that chase. Brian King covered this obviously very, very well. We obviously have talked about electronic smoking devices for quite some time now. Again, I mentioned the industry and just opposition in general at the beginning. We did want to just illustrate that, again, 63% of young Juul users don't know that they always contain nicotine. Again, it's sort of, as Brian was saying, the flavors really kind of get them to drink the water, and then the nicotine keeps them hooked. And I think that's indeed why sort of our greatest fear that we were going to have a new generation addicted to nicotine because of these candy-flavored, other flavored nicotine products has come to fruition. Looking at secondhand marijuana smoke, again, we have far less evidence and research on what all is contained in secondhand marijuana smoke, but we do have some evidence. Currently, there are 12 states or 11 states and D.C. that have legalized recreational marijuana use. We know from the California Office of Environmental Health Hazards Assessment, or OEHA, that some of the marijuana smoke contains many of the same cancer-causing substances and toxic chemicals as tobacco smoke, and you can find that document. It was June 2009 that they released their document, Evidence of the Carcinogenicity of Marijuana Smoke, where it lists the components of what's in secondhand marijuana smoke. And then also, obviously, again, it contains fine particulate matter that does pose health risks as it's inhaled deeply into our lungs. It can cause lung irritations. It can trigger asthma attacks, and it has been associated with respiratory infection. And it's been found to worsen respiratory conditions like bronchitis and COPD as well. And Brian talked a little about the Surgeon General's warning about secondhand marijuana smoke, and also just mostly that warning was about marijuana use on the developing brain as well as marijuana use during pregnancy. More about direct use, but again, the concerns, there's so many similarities between combustible marijuana and combustible tobacco that while, again, it's not the same, smoke is smoke in our opinion. And as Brian was talking about jumping from a 13th floor window or, a third floor, smoke is smoke. And inhaling secondhand smoke is not healthy for humans. So there is one study, it was done in rats, where it found that both tobacco and marijuana smoke impair blood vessel function similarly. So therefore, according to Dr. Matt Springer, people should avoid both, and governments who are protecting people from secondhand smoke exposure should include marijuana in those rules. So we're facing a public health challenge in some respects with legalized marijuana, both the combustible and the vaporized forms. We are finding that legalization is increasing exposure to secondhand marijuana smoke. We've heard in Colorado that, certainly people outdoors are reporting being exposed to secondhand marijuana smoke quite frequently. In California, they had conducted the California Adult Tobacco Survey from 2018, and they found an 86% increase in those saying that they've been exposed to secondhand marijuana smoke. Most of that is in multi-unit housing or on sidewalks. But, where California has been making so much progress, as many states have, but California now recently legalized recreational marijuana, that we're now seeing this increase of exposure to both secondhand marijuana smoke as well as secondhand aerosol from electronic smoking devices. So again, we are not anti-marijuana. We have never been anti-tobacco. We are pro-protecting non-smokers' health, and we support decriminalization, but we're concerned with what has become really this mass commercialization of marijuana and the heavy push for public use spaces. understandably, proponents of marijuana are saying, well, now we've legalized it, but where are we supposed to use it? A lot of it was legalized under the auspices of decriminalization and not under kind of this mass public use. So I think we are grappling with a conundrum here whereby, again, we've got this legal product, but where are they going to use it? And some would argue that the secondhand marijuana smoke is not dangerous, while we do have some evidence that it is. Not the same amount of evidence that we do on secondhand tobacco smoke, but there is evidence. So therefore, we believe that smoke-free spaces should be free of all types of smoke and secondhand aerosol, and that individuals should not have to breathe secondhand smoke or secondhand marijuana smoke where they live, work, and play. So we penned this op-ed about secondhand marijuana smoke and how it's not just a nuisance and it's dangerous. It is heavily cited. We talk a lot about the threats to our current smoke-free protections as a result of smoke-free states in particular that then have legalized recreational marijuana, and where we are starting to see push to allow indoor public use for cannabis lounges, clubs, cafes, yoga studios, you name it. So if you get a chance, I recommend reading this.
So this slide illustrates we're still doing more research looking at local and state laws that explicitly include a reference to the prohibition of marijuana use in otherwise smoke-free environments. So this map illustrates the beginning of that. What's interesting or of interest is that, for instance, right now, if you look at Colorado, it is a smoke-free state. It recently strengthened its laws to close a small workplace loophole and to add electronic smoking devices to that law. And at the same time, the governor also signed a bill that permits cannabis clubs, and they are still working on how that's going to shake out. But it is entirely possible that a state that we currently have noted as a 100% smoke-free workplace restaurant bar state may lose its restaurant and bar provisions when and if they institute the rules that will allow restaurants and or other businesses to allow indoor cannabis use. And again, that becomes significant because right now, if we pick on poor Colorado, it currently is noted as having 100% of its population protected by a smoke-free workplace restaurant and bar law, but that could roll back. And that 61% of the population that I wanted to increase to 100, 61% may be, dropping down to a lower number because there will now be secondhand smoke in indoor spaces. I recently visited a new cannabis restaurant that is in West Hollywood, California. It is the one and only restaurant currently in the state of California. It somehow got special dispensation, and I need to go back and review how that happened. It is a standalone restaurant. The food there are no edibles, and you have to purchase your food from the waitress and your flower and or vaporized THC product from a flower host. You can smoke inside and out. And when I went inside again upon leaving and the place was busier, I said, gee, I expected there to be more smoke in here. And they're like, well, our ventilation is really great. But we have known for some time now that ventilation is not a solution to control for secondhand smoke or secondhand aerosol. ASHRAE, which was mentioned 2 presentations ago, which is the association, the American Society of Heating, Refrigeration, and Air Conditioning Engineers, had earlier established a standard for acceptable indoor air quality, and they based it on an entirely smoke-free environment once that 2006 Surgeon General's report was released, and ASHRAE, which is a consensus-making body, had determined that there was a cognizant authority that said there is no risk-free level of exposure to secondhand smoke, and ventilation is not a solution. Well, in 2013, ASHRAE amended its standard for acceptable indoor air quality to include smoke produced from the combustion of cannabis and controlled substances and the emissions produced by electronic smoking devices. And so this is helpful to us both as public health community and as advocates because, this is an association that was studying indoor air quality and particulate matter And again, ASHRAE, in its ASHRAE journal in 2014, there was an article, The Hazards of E-Cigarettes, concluded that e-cigs should be treated like tobacco cigarettes because it was indeed just another form of indoor air pollution. The other document, which also just addressed e-cigarettes only, was a Current Intelligence Bulletin number 67 from April 2015. And again, it said that, smoke-free zones should include, well, at the very top here, talking about airborne emissions from e-cigarettes and other nicotine delivery systems. So again, we have some seminal documents and advice from federal groups talking about including at least e-cigs in smoke-free environments, and from ASHRAE, e-cigs, and marijuana. Looking at other policies, just briefly, we also track and analyze college campus policy trends, and we are finding that, again, given the science and those especially who are adopting policies more recently, they are more or becoming more common to have them be completely tobacco-free. While there are almost 2,500 campuses that are smoke-free, of those, 2,044 are tobacco-free, and of those, actually, of the smoke-free, 2,074 prohibit e-cigarette use, and 477 explicitly prohibit smoking or vaping marijuana. So again, it's becoming more common to include all of these products in tobacco-free policies to have completely, healthy environments. We have not been able to evaluate all of the Public Housing Authority policies, and we know that with the HUD rule, e-cigarettes were not included in that rule, but it also was not precluded from, it did not preclude public housing authorities from expanding their policies to include other products like e-cigarettes. I can say of the laws that we've analyzed for 100% smoke-free multi-unit housing, all of those laws are currently in California. 37 of those 51 laws that require 100% smoke-free multi-unit housing include electronic cigarettes. So again, really trying to keep the environments completely devoid of any of that indoor air pollution. Some more information as Brian was talking, and he was talking about the sale of flavored tobacco products. Currently, it looks like there are 26 municipalities that prohibit the sale of all flavored tobacco products. There are 122 or so communities that have some sort of a provision. And while I know that there is a deep concern about these flavored e-cigarette products right now, from our position as public health advocates, it's currently not the strongest policy trend, and it wouldn't be the strongest for public health to only eliminate the, flavored e-cigarette products. It should be all flavored tobacco products, which would include the little cigars, menthol cigarettes, and so on. And then also with respect to the Tobacco 21 laws, Brian was mentioning that I think there's 13 states or territories as of July that had T21 rules, and there's nearly 500 communities that require tobacco sales for the age of 21. So with that, I think I will stop and just thank you all for your attention and the opportunity to share, and see if you have any questions.
Thank you. So our first question, who can comment on recent studies that smoke joints marijuana contain 40 to 100 times more carcinogens in the lungs than tobacco smoke? I've read more and more studies being reported on exactly this, especially one to come from Stanford University.
Well, I would recommend that folks reach out to some of the researchers, which I am not. And you were saying from Stanford University? I know there's a couple at UCSF. So again, Matt Springer, who I cited in one of my slides, and Dr. Suzanne Schick have been doing work. Suzanne's been looking more at the sort of particulate matter in the air. But I know that Matt Springer and Suzanne Schick are good contacts for information. And, the challenge is, and again, this is just sort of the nature of the beast, but because marijuana is still a Schedule I drug, there hasn't been a lot of research that's been able to be done, certainly with federal funds at all. So a lot of the research is just now coming out of Colorado and some of the other states that have legalized marijuana more recently. So Colorado and California, I know, have been doing some good work, and potentially Oregon, because they were early adopters and have been doing some very good work around the issue.
Thank you. For our next question, this person asks, is there evidence for lung injury from the use of relatively pure products, i.e. a carrier with nicotine?
I would have to look. I don't know. I mean, again, I think well, again, I'm not the scientist, but what I will say and what I have heard from other researchers is that, when we inhale smoke into our lungs, whether it's tobacco smoke or marijuana smoke or we heard earlier about wildfires, or even if you stand over a campfire too long, that, there's no exit from the lungs. Once you inhale it, those particulates are in your lungs. And so whether it may be less damaging than other products, but I think that one needs to evaluate, sort of what level of risk they want to engage in.
Thank you. For our next question, this person asks, in addition to the national HUD smoke-free multiple housing mandate, emerging legislation, and landlord voluntary smoke-free apartment policies, how do you address the legalization of marijuana in people's homes where this is likely to counteract all of the successes we've realized?
Yeah, that's an excellent question, and it's something that we have been discussing quite a bit. Much of the laws that have legalized recreational marijuana have included a provision that says no public use. And the challenge for us is I would like to find a way where if we're going to treat marijuana in some ways like tobacco, so if we are only going to allow marijuana use where tobacco is used, there's still outdoor use of tobacco. And heaven knows that people are doing that already. So I think in terms of multi-unit housing, while we wouldn't want the particulate matter to be indoor, you would think that there is an opportunity to identify an acceptable area outdoors where people could use the product. I can't define what that is because I think it's going to vary for certain places. Some are more dense urban areas. We may or may not want to build something like they used to call butt huts on campuses where people congregate. But I think that we need to have a discussion that instead of rolling back clean indoor air laws, these smoke-free laws that have saved lives and protected people from exposure, we should be addressing how we might find other acceptable spaces outdoors where people can use the product, without then also adding to this issue of now criminalizing people who are using the product outdoors. So this has got to be multi-layer, where we're working with law enforcement as well as the housing authorities as well as, city lawmakers. And we've done that before. People used to say if people can't smoke in a bar, they're going to loiter on a corner, and then if people are loitering, the police are going to come by and unfairly profile or target certain smokers. And, we said that's interesting. We need to talk about that with law enforcement. So, I think there are ways to do this, and we have some experience from tobacco control. Whether or not it's exactly the same is a question, but again, I would argue instead of rolling back our smoke-free indoor air laws, which have life-saving protections, let's talk about where it is acceptable for people to use the product.
Well, thank you so much, Cynthia. We're going to move away from the presentations now. I do believe we still have a few questions. Looking at my notes that I've been looking at electronically, it seems like we might have questions from everybody as the day went on. But we will summarize those, and we will put them on our website. We want to thank all of our speakers. It was very, very informative, and we look forward to continuing to work with all of you as we work to improve our indoor environments. A few closing reminders. As a follow-up to this meeting, as I stated earlier, there were a few announcements that have dates that are very close. I think I'm going to look at a way to be able to put those on our site so people can at least get to those links while they're waiting for the full minutes. We will summarize any additional questions or other information that came in, and again, put that as part of our minutes and our follow-ups. We're always looking for ways to enhance our usefulness and our ability to share indoor air-related information or topic ideas. Currently, we are planning for our next quarterly meeting, to be somewhere around the second week of February. It is always on a Wednesday, and we will check calendars and schedules and try to set that up and let you know. Thank you again for joining us, and please come back next time.